In this video, we will discuss about how the coagulation works and what are the disorders related to coagulation. So this coagulation means that uh, clotting of the area where someone observed any injury in general terms. So what happens whenever a body suffered any injury at the near that body part, the coagulation or the blood clotting will take place, and there are three different pathways by which blood clotting might occur. Blood clotting will occur: intrinsic pathway, extrinsic pathway, and the common pathway. The function of intrinsic and extrinsic pathway is to independently activate this factor 10 so that it can starts to form stable fibrin cloth. So let us start with the intrinsic pathway, and we will also discuss simultaneously what are the problems that has been observed within the patient when we go through a specific pathway. So in the intrinsic pathway starts with uh, Higman factor or factor 12. It gets activated when it comes in contact with collagen, kallikrein, and HMWK. The factor 12 will get activated to factor 12A, and this factor 12A will activate factor 11, and that will activate factor 11A. And the absence of factor 11 has been observed in patient, and those patients are being called as hemophilia C, as it is mentioned in the uh, left bottom section. So the absence of factor 11 will lead to hemophilia C, and the intrinsic pathway will not function in those patients. So considered there is no hemophilia C, and considered the general normal case, factor 11 will activate factor 11A, and this factor 11A will activate factor 9. Factor 9 when it comes factor 11A when it comes in contact with calcium. So the factor 9 will activate factor 9A, and the absence of factor 9 leads to the hemophilia B and vitamin K deficiency, as this in order to activate factor 9 to 9A, vitamin K is also required, and this factor 9A will leads to the activation of factor 10. And uh, however, this factor 8 also plays an important role, as factor 8 with the help of thrombin gets activated into factor 11A, and this will also factor 8 and 11A when comes in contact with calcium will activate the factor 10. So absence of factor 8 will leads to two kind of disease. One is hemophilia A, and another one is one Willebrand disease, as uh, this factor 8 is if not there, then this might lead to decrease the efficiency of intrinsic pathway. Um, and this might cause the bleeding of blood for a longer duration of time. So let us now understand the factor extrinsic pathway. Extrinsic pathway is activated by external tissue by the tissue factor that are uh, that are formed whenever near the area wherever the injury has been observed. So what happens when the tissue factor gets formed? The factor 3 will get activated to factor 3A, and factor 7 will get activated to factor 7A. The absence of factor 7 will leads to is because of vitamin K deficiency. So whenever there is no vitamin K, then this kind of reaction has been reduced, or this kind of reaction or does not occur. This will lead to decrease in the efficiency of extrinsic pathway. And this factor 3A, factor 7A in combines with calcium will activate the factor 10, and this intrinsic and extrinsic pathway independently activate the factor 10. and this factor 10 will activates the factor 10A, and the absence of factor 10 will leads to, it is also because of vitamin K deficiency. So vitamin K is very important for coagulation. The factor 10A uh, and also the factor 5 will get converted to 5A in the presence of thrombin, and thrombin is usually formed whenever injury is observed. So this thrombin, this factor 5A and factor 10A in the presence of calcium will activate factor 12 to factor 2 to factor 2A, and this factor absence of this deficiency of factor 2 is also related to vitamin K deficiency. So this, after the factor 2A will get activated, that is thrombin. Thrombin uh, factor, it is actually related to thrombin. You can say that uh, when the factor 2A gets activated, it will finally activate factor 1 to 1A, that is fibrin, or it is related to fibrin. And this factor 1A in connection with the stabilizing factor, that is factor 13, will get activated to 13A, and this 13A in presence of 1A will leads to the formation of a stable fibrin cloth. So in this whole process, there are five kind of disease that disorders that has been observed. One is hemophilia A, that is the absence of factor A 8, and another one is hemophilia B, that is the absence of factor 9. And hemophilia B is also known as the royal disease, as it has been found in the royal families of England, Germany, Spain, and one more country during the 19th and 20th centuries. Royal, it is found in the royal families of England, Germany, Spain during the 19th and 20th century. That's why hemophilia B is also known as royal disease or royal blood. Another disorder is the hemophilia C. Hemophilia C is usually occurs when during the absence of factor 11, and the one Wille brand disease is observed because of the absence of factor 8, and the vitamin K deficiency will leads to many factors, will affects many factors, that is factor 7, 10, 2, 9. So all these factors get affected because of vitamin K deficiency. So these are the five disorders that are related to coagulation, and the coagulation pathways depend on three pathways, and the function of intrinsic and extrinsic pathway is to activate common pathway independently. That's all for this video. Thank you for your time. I hope you like this video. You will get some knowledge improvement, at least at the basic level. For more information, you can go through the description. Thank you for your time.